I now request Dean, Principal and Controller, Mahatma Gandhi Medical College and Hospital, Dr. G.N. Saxena, to address us and also to share the annual report of our university.
Honorable Chairperson, Dr. Vikas Swankar, whose birthday happens to be today, our Emeritus Chairperson, Dr. M.L. Swankar, our entire Board of Management, the Honorable Vice Chancellor, the newly appointed Vice Chancellor who's taken up the responsibility with good spirit, our ex-Vice Chancellor, Dr. M.C. Mishra, our students, doctor colleagues, nursing colleagues, and all friends in the university and outside. आज राष्ट्र के 74वें स्वतंत्रता दिवस पर आप सबको बहुत-बहुत बधाई. Friends, for the last 20 years, our great institution has been a part of the great nation's growth story. As the nation has grown, so has our institution. For the strength of the nation comes from the people and from the institutions of learning. At its peak of glory, this country was identified by Nalanda and Takshila universities, a model for all universities to look forward to, because that is the institutions of learning is what makes a country great. And the last 2 decades have seen an exponential growth of the cradle of medical science, that is Mahatma Gandhi University of Medical Sciences and Technology, leading rapidly in its progress to being the topmost medical institute of the nation. And this is in no small measure due to the vision and the efforts, tremendous efforts of Professor M.L. Swankar, now ably taken over by the young and dynamic Dr. Vikas Swankar, who has now donned the mantle. All organizations are recognized not by numbers, but also by quality. And not just quality, high quality, of which we have plenty. We have the leading transplant specialists in our hospital. We have people who are looking after critical care. We have one of the topmost neurosurgeons of the country who is part of our team. And this list is endless. We could go on. And because of this, our institution now heads the top of the list as soon as you talk of good institutions. And the last year has also seen a change in our Vice Chancellor. After leaving an indelible imprint on the institute, Dr. Mishra has handed over the charge to Professor Sudhir Sachdeva to carry on the arduous task. During his tenure, Dr. Mishra established the trauma services, the ATLS courses, the Advanced Trauma Life Support Systems, which are in high demand because the quality of training that they administer to the students who take part in this. And we have also made it compulsory for all our postgraduates, irrespective of their specialty, whether they are from medicine, surgery, or from any of the other fields, to take part or to go in for this ATLS training, because this gives them a wholesome understanding of the management of patients at the right time. As mentioned by Professor Sudhir Sachdeva, with a current UG, PG and DM strength of almost 144, 44 and 150, which is soon rapidly progressing to almost double the number, and soon we will reach the target of having 5,000 students on the campus. And that day is not too far, because having 5,000 students on the campus gives it a critical mass. And these are all students of medical fields. We are not talking of the general universities where they may have larger numbers. We are talking of the elite, the cream of our society, the medical faculty and the medical students, and all the allied branches, where we'll be having more than 5,000 students. So look at the creativity and the energy that will flow from this to the institute. And this includes new frontiers like DM in transplant medicine, critical care, and 140 new courses which have been started of 1 year and 2 years in different specialties, which will give rise to a greater understanding of the subject to the students studying that, and they will help the society in providing the technical manpower which will be then useful to the society in general. Dr. Sachdeva has dealt in depth about the normal times. These are not normal times. Corona has changed our society. It is changing financially, physically, and socially. Who would have thought that maybe 6 months before that a marriage would have only 50 people attending it, or even the other functions that are being held in great constraint. But that has changed things tremendously, and it has also changed medicine tremendously. Everybody is now presumed, almost everybody who has fever and cough is likely to have corona is the dictum, which is resulting in a better understanding of the disease, early catching of the patients, which leads to better recovery. And we have been at the vanguard in the diagnosis, treatment, and research in the field of corona, with about 50,000 deaths and hundreds of patients who have been cured. And this goes on to prove that a dedicated team of management focused on a single target can achieve results which go beyond the numbers. The people who are going back satisfied from this institute, those who have recovered, and those, even though they may have been unfortunately not been able to recover, do not have a word of, or they would like to praise the institute for the efforts made by the doctors, all our doctors, including our residents, the nursing staff, the faculty, everybody, to try to help them out. And a few unfortunately could not make it, but even they have not complained about one primary thing, and that is the quality of care and the level of dedication of our doctors and the team associated with it. Now, I would also like to say something about our undergraduate students. The undergraduate students last year have undergone a traumatic time in which their studies have been disrupted. They are studying from home, but within a week or about 8 days time, we had been able to come up with a platform which combined didactic teaching with PowerPoint presentations, and which has been taken very well. The platform was in place before that corona thing had come up, but in 7 days time, the entire faculty was sensitized to the taking of classes, to teaching, and the results have been good. And the feedback that I have been getting from the students and their parents has been that it's been keeping the students occupied from 9 o'clock to 3 o'clock in the afternoon. They have been looking at it, they are getting their exams, their online evaluation is being done, in which our team, the medical education team, has been of great help. And in the past year, we have had some good results. All our postgraduate students who appeared for their exam, which was delayed by about 2 months, were able to get through. And for the first time in the country, the exam for the postgraduate exams were held by simulated cases on mannequins and from observation from outside the institute. But that has been upheld by the Medical Council of India and the University Grants Commission, so that our students who are passed out will not have anything to regret or any failure on any account. So this is something that goes to the credit of our institution, that we have been able to adapt and change, because nimble-footedness is the hallmark of any institute which which attains greatness. The moment you have changes, you have a disturbance, you are able to adjust to that time, and that is to the credit of our university. The students in the last year who have had a good result include Ramesh Kumar, who attained the first position in the college in the third professional MBBS exam. The second position in the college was by Rajshri Somani. The third professional Part 1 university examination, the first position was by Namita Jain. The second position by Anjali Gupta. The second MBBS examination was also very good with an 85% pass mark. And you had the first position in college by Asishta Sharma, the second position by Soumya Gupta. And you will be, of course, you must have observed it by now, that of the 6 names that I have mentioned, only one has gone to a boy. The rest of them are girls, which is creditable for the girls of our college and our institute, and for the society in general, that the women are coming forward in greater numbers and holding forth on their own. With this, I wish you a happy Independence Day again, and Jai Hind.
Thank you.